So the important things about vitamin and mineral supplements is that they're really not regulated very well by the government. And this was, you may have heard of this, in 1994, it was the Dietary Supplement Health and Education Act. It's called DSHEA. And really the importance is that the FDA has a lot of responsibility in that it has to prove supplements are harmful before they're taken off the market. So really anyone can put supplements out there and they're not really regulated. And it's the FDA's job to actually pull them off the market if they're found that they're harmful. So a lot of supplements will be out there for years and years and years, like you've seen with fen-phen and other supplements that are available. And the other thing is that supplements, they can market claims that they support a body structure or function, but they can't say that they change a specific disease. So you could say supports a healthy immune system, promotes heart health, but they can't say will cure heart disease. So this is a typical vitamin. This is Suzanne was very nice and gave me a copy of this. So this is, again, you always have to look, as she mentioned, to see what the serving size is on all of your vitamins. So this would be if the serving size is actually 2 capsules. And if you look at the amount, they usually give you the amount in milligrams and then the percent of the daily value. So this is actually, we consider this a pretty good multivitamin. It gives you about 100% of most things. Most multivitamins don't give you calcium, and that's why you have to take calcium in addition. And that's pretty much across the board. So this one, if you look, the vitamin B6, they give you 2 milligrams, which is 100%. We've had other patients come in with a multivitamin like this, where the serving size is 3 caplets. But if you look, the vitamin B6, and it's hard to point out over here, so it's 250 milligrams, and this is a vitamin that's out on the market. So it's actually over 12,000 times the dose that's recommended as a daily dose. So these vitamins are out there, and they're marketed, for various health claims, and people think they're doing themselves a favor by taking them, but they may not actually be doing that. So Wonder Bread. I unfortunately grew up eating a lot of this as a kid, and I think most of the people here, this really is not a very good food choice in general. But the important thing is if you look at a container of Wonder Bread in one slice, as Suzanne was mentioning, so an average piece of bread has about 60, 70 calories a slice. And if you look in the bottom here, so a lot of them are supplemented. So they do have calcium, they do have iron, they have riboflavin, folic acid. And most people are not eating just one slice, they'll have a few slices. And if we look at a lot of the gluten-free choices that are out there, this is, I had gotten this off the Wegmans site, and I put a few different brands. It's not to target one specific brand, but you'll see when you look through all the ingredients, you'll notice that there is no fortification. So water and cornstarch, rice flour, potato starch are the top ingredients. If you look hard enough, you will find gluten-free grains that are fortified, but you just have to look at the label. And I apologize, this isn't reproducing well, it's in red. But this was off the Wegmans website. There are brands out there that do have iron, niacin, calcium, vitamin B6, thiamine, and riboflavin. So you just have to look a little harder, but you can find them. So this says, oh, for crying out loud, I can't keep up with all these food scares. So apples are bad for us now? This is Adam and Eve in the Garden of Eden. So I think it's really hard to figure out because there's so many things that you're restricting and taking away, but trying to figure out what are the good things. So these are a couple of scenarios that we usually see. So this could be a patient, and some of these you really have to be a bit of a detective and to try to figure out it. They're not always very straightforward and easy. So we may have, and this is something that we see a lot, patients with fatigue. They have anemia, they have very small cells when you look under the microscope or you get a CBC. So this is a pretty common one. Iron, right. So, Mr. Doty in the back, I heard him. So iron, so again, it's in the duodenum and proximal jejunum. And again, that's why, just to remember that in addition to food restriction, just if you have a lot of inflammation, you'll have problems, possibly. Another thing we do see sometimes are people with B12 deficiency. So in a B12 deficiency, you can also be anemic, but the cells themselves actually look bigger. So it's called a macrocytic anemia. And a lot of times patients will also have neurological symptoms, so numbness and tingling in their fingertips. Sometimes with some of the B vitamins, you'll have inflammation of the tongue, but for B12, the cells are usually big and people have neurological symptoms. And folate deficiency is also very important. So I saw a patient from Long Island about 2 weeks ago who's a nurse, She had been on a gluten-free diet for about 8 months, and she's of childbearing age. So that's the really important thing for young women of childbearing age, and the government has mandated that all these enriched flours add folate, because if you have low folate, you can have neural tube defects. So it's a big public health campaign, and that really hasn't carried over to the gluten-free grains. So I had a patient who had a very low folate last week. So we can also see this in patients with a B12 deficiency, and it's especially important in young women who may become pregnant. People don't typically have neurological symptoms from a folate deficiency, but you'll be able to pick it up on a blood test. So just as far as a group of deficiencies, I don't know if you can see this very well. So on the left it's a picture of a mouth with a very red tongue and cracks at the edge of the tongue, cracks at the edge of the lips. And also this is a big, very red tongue. So does anyone know what types of deficiencies this could be? So in general, they're B vitamin deficiencies. So if you see someone with sore cracks at the edge of their mouth, very cracked lips, or a very large tongue, it's called glossitis. Those are all B vitamin deficiencies. So this is, a patient perhaps could come in with a skin rash and some tongue inflammation, and also numbness and tingling in their fingers and toes. So this, I don't expect most people to know this, but this could be something along the lines of a B6 deficiency. So in the Celiac Center, we've actually had a lot of patients come in who have problems with B6, either too high or too low. And B6 is important because it's involved in your immune function and neurotransmitter formation, and it's found in meats, fish, whole grains, and nuts. So we've had a lot of patients who have numbness and tingling, and when we checked different vitamin and mineral levels, we found low B6 levels. And the opposite is true in that we found patients who also have toxicities associated with it. So like I showed you that early vitamin that had 12,000 times the amount of the daily dose, patients, if they've had too low B6 or too high, can get numbness and tingling in their fingertips. And it's really unclear. Something that we've been puzzled with is that it's unclear really what dose do you see toxicity. So the previous literature that I had seen had always mentioned 250 milligrams was a toxic dose. If you look on the FDA government website, they advocate not taking more than 100 milligrams of B6. But we've had patients taking 50 milligrams that have very high blood levels and symptoms, and when they come off the vitamins that they're on, the symptoms have gotten better. So it's something that we're interested in, and we're interested in looking at these patients and trying to figure this out a little clearer. So this is another potential scenario that we do see. So patient with celiac disease who has anemia, iron studies are normal. They may have low white blood cell count, but they're complaining of loss of sensation in their legs, possibly difficulty walking. And the big kicker for these could be that patients are taking zinc supplements.